To all my fellow residents of Niverville, I wanted to take this opportunity to share a few things with you. First of all, I want to say a large thank you to all of you for doing your part in limiting the spread of COVID-19 by practicing your physical distancing. It does matter, and it is helping. To all the frontline workers who are working in essential services, thank you for making a difference. I so appreciate all that you are doing to care for our health needs, to keep us fed, and to ensure we have essential goods by transporting them to us. Thank you for all your sacrifice during this time. If you are looking for more information as to what is happening in regard to the COVID situation, I'm referring you to a couple of places. First of all, to the provincial website, which is gov.mb.ca/COVID-19/ all important local links as well as communication from the town regarding COVID will be posted on our website. Just click on the link on our website, which is whereyoubelong.ca, and it'll take you to all the important information and how to get to the provincial website. Please direct all your Niverville friends and family to our website and this link if they are asking about local COVID information. The province has a public health order stating that all recently returned travelers must self-isolate for 14 days. If you know of someone who has recently returned and is not self-isolating, this is enforceable by the local RCMP. Thus, give the RCMP a call if you have such a concern. If they say that is not their mandate, I was on a conference call with all mayors and reeves in Manitoba this past Friday, and we were clearly told by the provincial municipal relations minister it is an RCMP matter to uphold any public health order. Now, to be clear, if someone has not recently returned and is not practicing physical distancing, this is not part of a public health order. And if you have questions about this, you should be emailing the province's health protection unit at healthprotection@gov.mb.ca. That's healthprotection@gov.mb.ca. These next 2 weeks are the most critical in terms of flattening the curve and limiting the spread of this COVID virus. So I want to encourage you to keep up what you are doing to ensure physical distancing. To those who are not, you need to start. This is very important. I know things are hard right now. Our physical, emotional, mental, relational, and financial well-beings are under attack, and I'll be honest, it sucks. However, please think of it this way. When one is in a gym and that last rep is in front of you, it will require the most effort, tear the most muscle, cause a great deal of pain, but provide the most long-lasting benefit so that one will be able to look back and say, remember when I fought hard to lift that amount? Now that is my warm-up. Right now, it is our character that is faced with some heavy lifting. Our patience, self-control, and compassion have been our greatest challenge to date for many, and perhaps for most of us. However, with maximum effort comes maximum results. Once we get through this COVID pandemic together, and we will, there will no doubt be stories for us to share about how we felt overwhelmed, angry, and frustrated, but how we did not give in and maintained our emotions during some of these most difficult circumstances. I want you to know whether you are dealing with frustration because others are not practicing physical distancing, or are you having to talk to your children about how they have to stay home while they see others playing together, or your routine has been turned upside down, or you are not sure how you will financially make it. I want you to know I empathize and I feel for all of you. Please keep going. Hang on. You can do this. Just like one has a spotter in a gym or a personal trainer who knows what to say to you so that you can lift that heavy weight, if any of us can be that personal trainer to others to help them with the weight they are facing, I'm asking you to please do so. I hear many stories of residents helping one another in many ways. Thank you. Please keep up all the good you are doing. You are doing great and important work anytime you are helping a fellow resident. For those that do not have such a coach and are struggling emotionally or mentally, there is a helpline set up by the province, which is 204-346-7038. For those who are having financial concerns, the federal government has some financial assistance, which can be found at Service Canada website, which is servicecanada.ca. I want to implore all residents to be persistent in maintaining physical distancing. COVID is real and is very dangerous. Some are not taking it seriously, and to those who are not, you are taking others' lives into your hands. Do not be fooled. The lawyers in this world are licking their chops at the greatest potential for civil suits should one be found to be in breach of a public health order or provincial protocols. I'm speaking now specifically to those who are gathering socially. Please stop. You may think your backyard barbecue is not at risk, but it is. To those shopping in our businesses who are not practicing physical distancing, our essential businesses are working hard to monitor physical distancing. They are using tape on floors and other guides to ensure we know where to be. Please honor that. Please be patient. If someone else is grabbing that box of Cheerios, please don't be in so much of a hurry that you think you will just quickly go around that person to grab your cornflakes. Wait. And if needed, wait a bit more. Your health is at risk, and the health of your family and your friends and their family. We simply do not know who a carrier is. And it could be that person you are trying to get around that suddenly sneezes just as you were going past. Or likewise, you could be a carrier and you might sneeze around that other person. Those few seconds you saved are not worth you getting sick and possibly dying, or having that person become sick or dying and you having to live with that for the rest of your life. Also, to those family members who are sneaking into our PCH or areas that are housing our most vulnerable population, or you're asking your loved one even to remove screens on the window so you can pass goods to them, this has to stop immediately. Our healthcare providers have enough to do without having to play security guard. You may think you're okay and nothing will happen, but this is a huge risk you are taking. If you are a carrier and you don't know, you could be passing it on to the very person in your life that is the most vulnerable right now, and that is your elderly family member. Should your loved one fall ill or die, is that really something you want to live with for the rest of your life? Also, if anyone contracts it, then sends every health worker who was in contact with your loved one home to self-isolate for 14 days. That could mean the closure of our PCH because we don't have enough people to work. Please do not be this selfish. I know your family member may not understand why you can't come around like you used to. My mother is in a PCH, and I haven't seen her in a few weeks. She suffers from dementia, and I can see her crying through the window because she doesn't understand, and it breaks my heart. But rather I suffer some sadness than risk making her ill or having to move her if staff are not available to care for her. So please do not just think of yourselves, but think of others. We are all in this together, and we need you fighting with us and not against us. Lastly, some of you have told me you are frustrated at the teenagers who you see hanging out together. I know their parents are trying to get them to listen and obey. However, if we are honest with ourselves, when we were teenagers, how many of us listened and obeyed everything our parents told us or people in authority told us to do? The saying goes is it takes a village to raise a child. Now is the time to do our part to help in this regard. Now is not the time to act in anger or frustration. Thus, I would say this. If you see this occurring and you are the type of person who can talk to them with respect, not in anger or losing self-control, including even if they respond by rolling their eyes to you or flipping you the bird, then please do so. If you cannot, however, please do not approach them. I know some have said that the only way some people will learn is to get tough with them and to yell and scream. What I ask is to try a respectful approach first. What I'm asking is that if there are any people in our community that have worked with these youth or know them, to be aware of when you see them gathering and please go and talk to them. If you work at our churches or drop-in youth centers and you see the youth around or on your property, you must have some kind of relationship with them, and they're more likely to listen to you than to some random person yelling at them. We need your help in ensuring they do not pass on or contract COVID, as they are also part of our community and are people I also care about. In conclusion, the next 2 weeks will be the most important time in limiting the spread of COVID. I want to encourage everyone to do their part to limit the spread. Maintain physical distancing. Leave your house only when necessary to do so. Do not go to nor host Easter gatherings. Hang in there in dealing with all the stresses. You are making a difference. You do have more strength than you might think right now, and we will get through this. Many hands make the workload light. The more of us that can pull together, the less stress there will be for all of us. I love you guys and care for each and every one of you. Stay strong and stay safe.